Good afternoon, everyone. Thank you so much for joining us today for this very important event. We will be talking today about the importance of children's and mothers' nutrition in the context of COVID-19. Thank you so much for being with us today. Today is, of course, the day of the UN Food Systems Summit. This is an extremely timely conversation we're having. Thank you to Smile Train, with which Devex is producing this event in partnership. And I'm really happy to be with you today. We have a great panel, great event planned for you, talking about this issue of malnutrition and COVID. We're going to be focusing on the ways these two issues come together and how malnutrition challenges that we were unfortunately seeing even before the pandemic have been compounded, and how some of the most vulnerable, some of those left behind are in fact mothers and children. So thank you again so much for joining us. We are going to be starting our session today by screening a video, and we look forward to having you with us. Thank you.
Mi hija Gianna tiene 1 año de edad. Las primeras semanas después de que Gianna nació fueron momentos difíciles, ya que Gianna no podía alimentarse normalmente. Ella quería que yo le diera leche materna, pero no se pudo, lo intenté muchas veces. Entonces tuvimos que optar por conseguir el biberón especial, pero tampoco ella pudo acomodarse. Entonces le empecé a dar el biberón normal y la sorpresa fue de que con este sí se acomodó. Los problemas que ella tuvo para alimentarse con el paladar fueron que pues la comida que ella ingería se le iban directamente a la fisura que ella tiene. Entonces como que la ahogaban un poquito o empezaba a estornudar. La manera que hice de informarme sobre este problema fue primeramente por internet. Ahí empecé a buscar casos donde habían otros niños de esa manera y fue ahí donde me empecé a guiar de cómo poderles dar el biberón y cómo poderlos alimentar. Ella no podía comer ciertos alimentos. Empecé a licuarle todo y pues hasta ahorita, gracias a Dios, todos los alimentos puede comer. Una persona amiga de mi esposo tiene el mismo problema su niña, entonces ella me dijo, ¿sabes qué? Aquí hay un hospital donde puedes llevar a tu niña y te la atienden muy bien y ahí le van a hacer la cirugía, van a darte todo el tratamiento que tú necesites, y fue así como yo pude contactar a esta fundación. Me mandaron a un tratamiento de ortodoncia donde le proporcionaron una plaquita para que ella pudiera alimentarse mucho mejor y pues ya la comida ya no se le fuera a la fisura que ella tiene. El consejo que yo les daría a las familias que sus hijos nacieron con este problema es que no se cierren a buscar ayuda, a buscar un tratamiento para sus bebés. Sé que es difícil, lo he pasado, pero cosas que vemos imposibles se han vuelto posibles. Pues ese es mi deseo, que ella crezca como una persona normal.
Thanks so much for joining us today. I am thrilled to have with us for this conversation Patraleka Chatterjee, who is an independent journalist and columnist, and Mamta Carroll with Smile Train. Thank you both for being here. It's nice to see you.
Thank you for inviting us.
So I am so pleased that you are both here for this conversation. I want to start out by giving a bit of the big picture. Why has the COVID crisis that we have all been experiencing hit children particularly hard when it comes to malnutrition? Mamta, let's start with you.
Yeah, I think children are the most vulnerable members of any society. In developing countries and amongst the underprivileged communities, this vulnerability is exponentially heightened. It's a, it is against this backdrop that multiple waves of COVID with the socio-economic and health-related impacts like livelihood have occurred. And specifically, children with clefts face these challenging additional ones. Clefts, as you know, is a disability which is not recognized. Cleft care is time sensitive. It makes it extremely difficult for babies to breastfeed even when the food supply is abundant. So here you've got children, you've got, the children, malnutrition children receive in the first 1,000 days of life. If they don't receive the appropriate nutrition, it has a permanent impact on their physical growth and their mental development, and subsequently on their education and future economic opportunities. So therefore, children are the most vulnerable lot in our society.
I think you raised such a great point there where we, have to think about this not only as a crisis we are experiencing right now that is very real when, plenty, unfortunately, of children around the world don't have enough to eat. But like you said, that's going to impact them for the rest of their lives. This isn't just a problem we're having now. This is something that's going to affect children. Petrolika, I'd like to come to you now for your perspective on this. How are you looking at both the situation right now and that forward looking view of what this might mean for children for years to come throughout their lives?
I actually have been following this specific issue for more than two and a half decades, and definitely very closely from the onset of the pandemic. I have not been able to travel that much, but going into slums, going in, meeting communities who are really marginalized, specifically looking at child undernutrition, and I've written a couple of articles for the Lancet, etc., on this specific issue. So there are many reasons. Talking about from the Indian perspective, India is where I'm located, Delhi is the national capital. It's one of those real paradoxes that we've generally been doing quite well economically over the past few decades. But we have on the child nutrition front, we have a very sorry, picture story to tell. And so, but one third of the children are, malnourished, stunted. Now, one thing to remember when we are talking in terms of, COVID and child nutrition, and as Mamta mentioned, looking at it not just through the numbers, because let's face it, we don't actually know what the magnitude of the problem. We do have some surveys, including the national surveys, but I like to look at it through the vulnerability lens. And the main one of the key things to remember over here is that the vast majority of Indians who are working are actually in the informal sector. Now, the informal sector means they have no contract. There's no obligation of the employer, to give you anything. There's hardly any social protection. Now, what happened when during the pandemic and then subsequent lockdowns, that they all got retrenched, or they got even now as we speak, when it's actually reopening, even people who have got back their jobs, they're getting only half their salary or just a percentage. So the child undernutrition story, which was already a legacy problem in India, in many countries, including India, but I'm right now speaking in India, stroke South Asia, we already had a problem that just got much worse because the child, the child is not, it's not existing in a vacuum. So if the vast majority of your people are in the informal sector, the family as such is making very little money, right? They're not, I mean, I've gone into, I've done columns like why hunger doesn't make headlines, because we also had a lot of deaths, people, gasping for oxygen. So somewhere malnutrition kind of gets muted, child undernutrition. And I can imagine, Mamta, if child undernutrition and malnourished children gets muted in this pandemic, in the larger thing, what happens to the subsector within it, children who are differently abled and undernourished. So,
Yeah.
I mean, I'm right next to my house, quite close to, there was a slum I visited where the mother says, I have to slap my children because they're asking for vegetables and fruits, and I can't afford to give it to them. We do have a lot of government programs like mid-school meals, midday meal, Anganwadi, that's the childcare centers, but all of these were disrupted. What is happening now, and they are reopening. For instance, now they're getting dry rations. But when the family has very little money, just yesterday, I spoke to one of the actually frontline workers, not frontline workers, a community worker in a slum right next to my house. And I asked her this very question that you're asking me. And she said, in many families, again, India is a very diverse country. So it's not one picture. That's another thing to remember. Different states, different districts perform differently, and there's also a huge urban-rural divide. And she said, when you get dry rations for the child, the whole family eats together. I mean, it gets divided. So you can see, because there's so little money, there's so little, overall, and there's food inflation, remember. So these are some of the reasons, that the existing programs have got disrupted. There's overall less money. And then we've had a legacy, and then maternal undernutrition. We're talking about mothers who are also undernourished, So I think all of these are coming together, and it's hitting different children. If there's a differential impact, some are worse hit than others.
Mamta, you had something you wanted to chime in with.
Right. So I just wanted to add to what Patralekha already said, that actually malnutrition worsens the cleft condition through stunting, weaknesses, etc. This leads to a greater exposure to complications, in fact, even to mortality. Coming back to India, that's because, that's where we are, and that's Smile Train's largest program. And, the kind of volumes that we do in a country like ours, where 35,000 children are born every year with clefts. That's the numbers we are talking about, where more than two-thirds are, as living in the rural areas and the real, poor sections of our society. And these rural settlements and the pandemic, they have, both of them together have put extreme pressure on the already limited health infrastructure in our country. And this has had a direct and adverse effect on child and maternal health. You see, the health workers, whether they're Anganwadi workers or Asha workers or nurses or midwives, whoever you may, who have been in the health sector working with the health departments, they are now deployed in COVID-related activities, whatever the country has to offer, because they have to take care of vaccination and they have to take care of sanitation and so on and so forth. With the result that pregnant women, especially in the rural settlements as well as urban slums, have lost access to their last resort during these crucial months. In fact, there's a study which shows that there's a decline, 28% decline in institutional deliveries just during this time, and 22% decline in prenatal services during the pandemic. So you can imagine the kind of problems that we have at hand. Smile Train launched, I'm sure Patralekha, you know about, and you write in your article, you talk about the Poshan Ma, you talk about the nutrition mission in our country. Smile Train launched an initiative or an awareness campaign focused on this very important disability, which is, the cleft condition, which unfortunately no one talks about. That what do we do? One, there is a pandemic. Two, there is a child which is born with a cleft. The child in the first place doesn't know how to, is unable to breastfeed, is unable to take that milk, and especially in the crucial 1,000 days of the child's birth. So what do you do? Then teaching mothers how to feed, teaching mothers how to take care of the children, get them ready for that, at least one lifesaver surgery, at least. So all these external factors, whether it's a pandemic or the limited health infrastructure that we have in our country, has put an additional burden on specifically maternal and child health in the country. It's extremely unfortunate.
And Patralekha, I wanted to ask you, from your point of view, from where you are in India, What can NGOs like Smile Train and others be doing to ensure that vulnerable groups like children and nursing mothers are not left behind as we attempt to come out of this COVID-19 crisis that has also led to the malnutrition crisis that we're seeing?
Well, as a journalist and a writer, I would say that, for instance, there's a huge data gap. And by that, I mean a granular data gap. The thing to remember about India is there is no Indian figure. And if you have that Indian figure, it doesn't tell you anything because the average completely masks, the huge diversities, the disparities. So for instance, the National Family Health Survey, we've only got the first phase. And that doesn't include the most populous states like Uttar Pradesh, where the child undernutrition and malnutrition problem is acute. That tells you that the stunting picture was already very bad. I think in 13 of the 22 states for which we have data, things have actually got worse or it's stagnating. Now, so that's a legacy problem. I think that what NGOs and community-based organizations, including Smile, can do is to firstly make this, like I said, I wrote a column, "Why doesn't hunger make headlines?" Typically hunger is, starvation, death is easier to talk about than hidden hunger. Malnutrition. So typically it gets talked about if there's an international report being launched or a UNICEF report, and that's very good. But it's not something which happens only one day a year. So I think we have to put it on the table, flag the gaps in the information. Now we have civil society organizations like the Right to Food campaign, and there have been things like Hunger Watch. They've actually been holding public consultations of the very hungry people, from the front line and come and talking about this. I think we could discuss more about child nutrition over there, put these issues on the table and then push. In a democracy, that's all you can do. And as journalists, we can write about it, but I think we have to talk and, highly focused pressure. Like, Mamta, I'm so glad that we're talking about this now. I don't think even I've written any article, and I've written a lot about hunger, specifically in connection with, disability. So disability is a kind of vulnerability. So I think within the vulnerable, we also have to flag the more vulnerable within the vulnerable. So I think putting the issues on the table, asking the government to be accountable, coming up with data. We just had recently, I think in the Rajya Sabha, that's in the parliament, the minister herself admitted that there are more than 900,000 severely acute malnourished, SAM children. And that is bound to be a gross underestimate. So now, we have nutrition rehabilitation centers for these children. Are they working? Are they not working? So I think all of us, have to keep asking questions and demanding the answers and putting these issues on the, high table. And the last thing I think, I sincerely believe that the community, the frontline workers also need to be on the high table. Not just, they need to be, because we don't really know what's going on till we speak to people who are facing this, on a day-to-day. So they also need to be on the high table, talking to the policymakers. So, and we, as journalists, we write about it, we focus on it.
Thanks so much. I think ending on that call to action is a great place for us to bring our conversation to a close. Mamta, Petrolika, thank you so much for joining us today. It was a pleasure speaking with you both.
Thank you so much.
Hello again, everyone. Thank you so much to Petrolika and Mamta for joining us earlier for that conversation. A great scene setter for the panel discussion we are about to have. And we also got to see that video, which Devex produced in partnership with Smile Train, and that was a part of our Building Back Health series. And we'll have a link to that in the chat so you can take a look at that. And that series has a bunch of content, visual stories, perspectives from the ground, high-level interviews, all about strengthening health systems post-pandemic. So we really encourage you to check that out. Now I am pleased to welcome to the virtual stage our esteemed panel. We have joining us Grania Maloney, who's the Senior Nutrition Advisor for Early Childhood Nutrition at UNICEF. We have Dr. Mira Shekhar, who's the Global Lead of Nutrition and Population at the World Bank. And last but not least, Dr. Felicity Vindhya Mendahale, who is the Medical Advisory Board member for Smile Train and co-chair of the Smile Train Research and Innovation Council. Welcome to you all. Thanks for being with us. It's such a pleasure to see all of you, and we've had the opportunity so far to sort of have a scene setter. We saw that great fireside chat. We've seen the video, so our audience understands a little bit about this issue as we're beginning here with our panel discussion. And they told us a little bit about this issue that we're going to talk about, but I think now we have the opportunity to really dive in deeper. And Felicity, I'd like to come to you first to hear a little bit more about your perspective working with Smile Train and the things that you're really noticing at this moment in the pandemic, and how perhaps your work has been affected, or the levels of malnutrition that you have noticed in your areas of work after the pandemic. How are mothers and children being affected by this? Oh, you're still muted, Felicity.
One point about clefts is so often people just think it's a gap in the lip and it affects appearance. But most clefts affect the roof of the mouth, the palate, which is responsible for, we take for granted, but without it, you can't swallow without food going in your nose. I couldn't speak to you today, and food would come back into my nose and actually might even make me choke and die because I can't breathe properly. And these babies cannot feed. They can swallow, but they can't suck. So the trick is to manage to get the milk into their mouths. Unfortunately, most of these babies globally present when it is too late to turn the clock back. They are undernourished. Those precious first few days that Mamta was talking about are lost. Mums blame themselves because they think, I'm a bad mum. Why can't I feed my baby? And we end up picking up the pieces. And saddest of all is they are not safe to undergo surgery. They can have the best surgeons in the world, but it is not safe to operate on these malnourished babies. By the time we then try to correct it, mum's milk has dried up. So that baby has lost that wonderful chance to get mum's milk. And I want to paint a contrast. Where I live, I grew up in India, but where I live now, babies get feeding advice within a few hours of birth. Mums get breastfeeding support. They get shown how to feed their babies. Babies I see are chubby, healthy, chubby-cheeked babies, which is what we all want to see. And I say this as a surgeon. Surgery, the operation, is a tiny, tiny part of making these babies better. What we need is early diagnosis and early intervention. And that comes down to training. That comes down to teaching, counseling. And I am so, so, so happy at what Smile Train is going to do over the next 5 years. We're going to have over 1 million mums and babies getting specific cleft feeding counselling. And that matters because I have seen, without that specialist advice, babies with clefts actually work extra hard. They make a lot of noises, and to the lay observer, it looks like they're having a great feed and doing well. All the while, they are not getting nutrition. They are wasting energy on trying to feed. And they're sometimes wasting energy on trying to breathe. And that's why we see babies who are too undernourished to even be safe to have surgery. So we hope that with this 5-year plan of over 1 million babies and mums getting proper advice, we'll prevent over 55,000 cases of malnutrition. And that will be rolled out at over 1,000 of our partner hospitals in 70 countries, particularly in India. And I must stop, but I was smiling and nodding when Patruleka was talking. We need data because data tells the whole picture. And as a surgeon and academic, I think that's what will help policy change. And the other thing, I nodded and smiled when she said, we need to hear from the coalface community health workers, the challenges they face and how we can help them do their jobs better. the Anganwadi workers, the community health workers, they should have a seat at the table. They are the experts. We need to help them do their job better. So I'll shut up now, sorry.
Thanks so much, Felicity. That was an excellent overview, I think, of this issue. And I loved how you talked about sort of the importance of education on this issue, and how if, you know, a baby looks like they're feeding, a mother might not realize that they're actually not feeding. And, you know, if you're not given appropriate access to resources and care, you may think, you know, you're doing the right thing. And unfortunately, it could actually be harming the baby, which I think is, you know, some of the importance of the work that Smile Train is doing to ensure that, you know, people have access to the resources that they need when it comes to this issue. Grania, I would love to come to you next and talk a little bit about what UNICEF is doing in this realm. Obviously, your focus is on children, and
Yes.
Unfortunately, we have seen, you know, such an increase of malnutrition during the pandemic. You guys just recently released some new research. Talk to us a little bit about how UNICEF is approaching this issue, and how are you trying to center, you know, the response to malnutrition in all of the work that you're doing?
Thank you so much, Teresa, and delighted to be on the panel. And so much of what the first session said has really set up the points about why UNICEF is really continuing to flag this crisis and actually giving new attention to this crisis. And perhaps the first point is we need data. We need people to know what is going on globally, because without data, if something is invisible, it won't get the attention it needs. So yesterday, UNICEF did reach a flagship report called Fed to Fail, the crisis affecting the diets of children in early childhood. And this is looking specifically at the complementary period from 6 months to 23 months, which never gets the attention it needs. But as very eloquently outlined in the earlier session, these are the crucial days, the crucial months. And these are singularly, can protect you from future, so many issues around obesity, around heart disease, around cancer. If we don't get it right in the first 1,000 days, we have missed this opportunity. And yet for some reason, the nutritious diets for young children is not getting the attention it needs. So we put out this report on the eve of the UN Food System Summit to say we need to put attention on this particular group. So if we want to start on some of the findings, what's very depressing is that in the last 10 years, we have not seen any progress in this area. And the report looks at data from 165 countries and represents data from over 90% of the children between the ages of 6 to 23 months in the world. So we're saying, really, we're not seeing any progress. And of course, that progress is not equal. We are seeing that some regions are performing worse than other regions. And sadly, they are the South Asia regions, they are the sub-Saharan Africa regions, where we're not seeing the progress that we need for our children to actually really thrive, grow well, and develop and be able to have a productive future. Some of the reasons are they're not being fed the right food at the right time. It's very clear when we should introduce nutritious food to children from the age of 6 months, but it's not happening. So for example, only 27% of infants between 6 and 8 months are actually being fed solid food. They're still being kept on liquid. So they're missing out on those key nutrients. We also know that children already disadvantaged, and this again touches on an earlier point, the children in the rural communities and the more disadvantaged communities in the poorer households are the children that face the highest burden. And then what's also becoming more and more apparent is it's not parents, even if they want to access healthier food, they're finding it hard to actually access that food and to afford it, because a lot of the cheaper, very ultra processed unhealthy foods are much more affordable. And sadly, we have seen from our reports during COVID that there is an increase in the consumption of the foods. With in 8 countries, we actually saw that at least 1 serving of an ultra processed food or drink was being given to these very young children between the ages of 6 months and 2 years. And that's really worrying, because taste preferences and getting children used to drinking just plain water, you really need to start that in early life. So if children are being exposed to sugary drinks, you're setting them on a bad pathway towards obesity. So by putting out this report, UNICEF is basically trying to flag that this is a priority, that we need to use a multiple system approach to start focusing on these children. We need to make sure that governments prioritize access to nutritious food, to make it affordable and make it available for the poorest households. And we also need to make sure that families are given the skills and the counselling and the support to actually make sure that they demand nutritious food, that children, it's desirable, that people want that banana over that processed food. We need to get our children to want to drink water. I think that advocacy of Ronaldo at the Euros was fantastic when he moved aside the soda and he took the bottle of water. We want children to see that as desirable and want to be the ones to drink the water and not the soda. We need to make sure our health and our nutrition counselling services are providing the information so that parents are aware of what foods their children should eat at what time. And we need to make sure it's visible. So by having data, by having targets, by having trends, by having budgets in national governments dedicated to this particular age group and making sure that nutritious food for this age group is available and affordable, that's how you make it visible, and making targets. And in fact, with the UN Food System Summit today in New York, and also the Nutrition for Growth Summit, we really hope that governments step up and start making commitments to improve the diets of young children.
Thanks so much, Grania. That was a great overview of the, all the research that UNICEF is doing. And, you really emphasize the importance of having governments acting on this and making the space budgetarily. So Mira, I want to come to you to talk a little bit about the financing piece. First, how the World Bank is thinking about this issue, how you prioritize it when you're thinking about the work you're doing, as well as how you can tie that to incentivizing governments to be doing what Grania was just saying and also prioritizing it in their national budgets.
Great. Thank you very much, Teresa, and wonderful to be part of this very interesting panel. Before I get to the financing issue, I just want to emphasize two issues that my colleagues brought up earlier. First, the issue around Cleft and differing abilities. I think it's also important to remember in that context the importance of maternity leave and maternity benefits, which is absolutely critical for moms in quote unquote normal kids. But when kids are differently able, that maternity leave becomes even more important. And we have some estimates for what that might cost. Second, on the issue of data, I think absolutely critical that we have data and we have granular data, both global as well as national and subnational levels. And that includes data on financing. I know everyone talks about how little data there are on actually the epidemiological issues around malnutrition. But if you look at the financing data, it's even more sparse. So a big plea that I want to make about building systems that can capture financing data going forward. So getting to the financing issue, as you know, Teresa, before, we've talked about the investment framework for nutrition, where we estimated roughly $7 billion a year that was needed to achieve the global nutrition targets. It seemed like a lot of money, but if you look at the kinds of numbers that are being discussed today at the UN Food System Summit, which run in the billions, those numbers are actually quite modest. And the potential for impact is significantly more than we have ever estimated before. As many of my colleagues have already said, if we invest that in the first 1,000 days of a child's life, it can have lifelong benefits just for the child, but also for the global public good in terms of increased productivity and human capital in countries that will drive future economic growth as well. So this was our prediction. We were hoping monies would come in. Well, it really didn't come in, certainly not at the levels that was needed. And then what happened? COVID hit. What that led to, as others have said, is disruptions in health and nutrition services, economic hardship, so on and so forth. And what does that mean? We are anticipating somewhere between 2.6 to 3.6 million more stunted children across the world, over and above the 149 million that were already stunted. And large number of them are actually in South Asia and Africa. And we are anticipating anywhere from 9.3 to 13.6 million more wasted children, severely malnourished children across the world. So that's COVID's impact. What does it mean in terms of financing? Well, as I said, we didn't quite get the resources that we were hoping to get globally. And then Now we need to add the impact of mitigating the impacts of COVID, and that is estimated roughly at about $1.2 billion annually. So more money is needed. The situation is becoming much more dire. It's becoming dire because countries that we were hoping would be able to finance some of this from their domestic agendas, well, their economies are struggling with COVID. And overseas development aid, we are seeing it decline as well. So this is a real conundrum. We need to protect domestic resources. We need to protect overseas development aid because it is so essential to building human capital, to building back better. Everyone's talking about building back better, but we are not as yet seeing the resources that are needed to get to that. And, is it possible to do? It certainly is possible with the right kind of political commitment. I mean, currently we see approximately $700 billion of subsidies in the agriculture sector. Many of them are regressive subsidies. Can they be repurposed? Absolutely. There are conversations about that happening in the Food Systems Summit. And I also want to say that at a time like this, when both overseas aid as well as domestic budgets are constrained, the private sector needs to be a part of the solution. We've heard a lot from the private sector that they want to contribute in a meaningful way. But all we've seen up to now is really small scale, what I call CSR contributions that are not really meaningful. And as others have said, what we've seen on the contrary is private sector marketing ultra-processed foods, high sugar drinks, sugar sweetened beverages, junk foods, and really adding to the problem of obesity. And we know there's some data already out that show that obesity actually increases mortality related to COVID. So I can go on and on forever, but I just want to end on that note for now, that perhaps we need to lean on both the private sector as well as innovative financing facilities to be able to fill this gap that is there in financing, and perhaps think about private sector a little bit differently. Can we engage with venture capital financiers of the private sector and say, if you are truly committed to environmental and social governance, and you are an investor in this sector, can you find a way to reward healthier foods? Let me stop there. I can go on forever, as you can see.
Thanks so much, Mira. I really appreciate everyone's passion. Felicity, you want to chime in on that?
It was following on from what Mira said about the private sector getting involved. I think one area that we really should and could make a difference is something that has been exacerbated by the pandemic, which is the use of telehealth, and that has made healthcare and crucially healthcare advice available to people without having to travel. But it has highlighted a new, very severe inequity, which is if you do not have access to reliable broadband or mobile broadband, you are the poorest of the poor in terms of accessing advice, simple interventions that can be delivered so cheaply, but we cannot reach the people who need it the most. And I think we know that remote advice for feeding works. We know, Mamta said so eloquently, institutional births have gone down, antenatal diagnoses have gone down. So mums are left at home with only their aunties and grandmums to give them advice. Now that may work a little bit for babies without clefts, but for babies with clefts, there is no body of knowledge. No mum knows how to feed a cleft without advice. And something we've been using since 2006. I'm based in Edinburgh, and we cover the Highlands and Islands and the remote Hebrides. And we've been using telemedicine to help feed babies since 2006, and it makes such a difference. And if people want to improve health equity, improve broadband, there's a call to people, there's a call to private companies. Come on, we've got to do it.
I love that call to action. And I think, that shows us how important connectivity is to everything, right? We've seen so much of our lives shift online during this pandemic. We're having this event right now with all of us all over the world talking virtually. And we have to remember that not everyone has access to the resources needed, whether it is healthcare or education, all the things that we've seen move online. And I think you're right that there are solutions to these problems, but we don't necessarily always have the resources in place. It's not like we don't know how to fix it. We just don't have the money for it. Mira, go ahead.
Yeah, I just wanted to pick up on Felicity's point about telehealth. In addition to telehealth, there are, and certainly agree with her that we need to push broadband access to those who don't have access. But one statistic that stuck in my head from many conversations is that there are more cell phones in India than toilets. And if that is the case, why are we not using that as a mechanism to get our messages out? I know that I come originally from India, but I haven't lived there for a few decades. But I've heard from our country team in India that the Anganwadi workers in India, who are the frontline workers of the Child Development Program, they've actually been using cell phones, not only to give advice, but also to collect data, going back to the earlier point about data. So I think we could do a lot more with what we have. And that goes back to my other mantra on financing. Yes, we need more money for nutrition, but we also need more nutrition for the money that is available. How can we maximize what is available and get more bang for our buck, or more nutrition for the money? Let me start there.
Yeah, Grania, why don't you hop in here? Tell us a little bit about how UNICEF thinks about this connectivity and technology piece and how you might be integrating that into your work.
Yeah, absolutely. I think like everybody else, and in fact, this time last year, I was based in our regional office in Nairobi when the pandemic hit, and we were scrambling to say, how do we continue to sustain our essential services across the region? And one of the interventions that was probably the most successful in sustaining was in our outreach counselling. So we were able, and this is where partnerships with the private sector can be very interesting, where you look at then accessing the bundle SMS platforms for free. It's part of the CSR. You look at ways of how are there cheaper platforms to do training of health workers. So we really were able to reach an extraordinarily high number of women. Of course, the challenge is, do we know whether they use that information and whether they were able to make those choices that they preferred? And one of the biggest challenges actually at the beginning of the pandemic was the fear of breastfeeding, especially if a mother felt she had COVID. So that was one of our key messages. How do we get this information out to say the safest thing for mum and baby is to keep them together and for that mum to breastfeed? So we really tried to focus on all these different channels, and I believe we were able to reach more women in fact than we normally do. That said, the private sector still came in and started to use tactics to instill fear in mothers. There was a lot of code violations where we saw that they were using kind of COVID language, which was really outrageous. But that's why we need to prioritize getting information, informing mothers and letting them know what are the right decisions for them and their baby. But one statistic that we are now looking, and we're about to publish a paper on it, is so what's happened in terms of our services and how are people affected? And we are UNICEF reports on the vitamin A coverage for children of 6 to 59 months. They need an optimal dose, 2 doses a year, to be protected against disease and to meet their requirements. And when we normally report on 49 countries from across the globe, about 60% of eligible children get 2 doses. That was the latest data in 2019. In 2020, that has now dropped to 41%. So we have seen a massive drop, and 19 percentage point drop in coverage. And it's sadly, it's again, mostly in the countries that are more fragile, that have more fragile health systems, that rely on external funding, rely on campaigns. And the countries that have invested in health systems, in routine supplementation, did much better. So again, it shows you that to protect against future pandemics and shocks, you've got to invest in your health system. You've got to make these services available to everyone, everywhere at the right time, because now we have a whole cohort of children that have missed out on that essential dose, and that puts them at risk in the future as well.
Thanks so much, Grania. I want to take one of the questions that we're getting in, talking a little bit more about the funding piece, but for the NGO side. So maybe Felicity, you can speak to this. You know, NGOs are doing a lot of work in this space. They're wondering, what problems do you face raising and acquiring funds, and do local governments seem to be inclined to solve this issue? And I think that's, you know, particularly relevant. Maybe we can add on to that in the COVID context, when there are so many demands on both, you know, NGOs, international system, and local governments that are responding to massive health crises in their communities.
I think one of the challenges is that our first job is to make people aware that clefts can cause malnutrition, that without feeding advice, babies do die. We're battling against the perception that clefts just affect the lip and just affect appearance. So step one is defining the type of problem. Step two is the magnitude of the problem. And one of our Smile Train commissioned a fantastic study done by Barbara DeLange and colleagues at Smile Train, looking at the prevalence of malnutrition, wasting and stunting in babies who turned up for surgery. And my worry is that's the tip of the iceberg. There are babies who die before they get to a Smile Train centre. So we've defined what we need to do. We've defined the magnitude, or we have some idea of the magnitude of the problem. Now it's raising awareness of it and making people see that cleft care is not just about the operation. So I think I'm delighted at the funding they have raised, but we always need more, because yes, 1 million mums and children getting feeding advice and counselling, 40,000 educational opportunities, which we then will train the trainers to train other people, getting babies referred early. We need to do more. We want to do even more. So this is an amazing start. But I think it is also helping local governments and healthcare policymakers see what needs to be done and making it easy for them to invest in what needs to be done. And I think also looking at the bigger picture, because getting it right first time for kids is not only the right thing to do, but it's cheaper in the long run if we have happy, healthy babies growing up. And I think, I can see nods everywhere. I'm going to stop, because that's what we all want, isn't it?
Absolutely. Grania, go ahead.
Thank you. I wanted to talk specifically about infants that are born with clefts and the importance of looking for options to feed these babies with express breast milk, because that is what is best for them. If ever there's a silver bullet, it exists in the form of breast milk. We know the evidence is so powerful. It is the best for the mom and the infant. And in fact, express breast milk can stay safe at room temperature level for up to 8 hours, unlike formula milk that you have to discard after 1 hour. So it's designed, it can be expressed when there is a need, such as in the case for these children, but the mums need to be given the counselling, the support, the tools if they have special needs for special teats, so that they can make sure that that infant can swallow and gain the nourishment from breast milk. So we have done, as part of the Global Breastfeeding Collective, there's a recognition that there's not enough out there on counselling support for real professionals on how to protect and protect breastfeeding through the right levels of counselling. So there are these wonderful new tools now out there on counselling support, and we really want to make sure that we disseminate and get that information to the right people, because it's not a skill that everybody has. It doesn't come naturally to all community health workers or mothers or grandmothers or aunts. These are specific skill sets that need training, need support, need guidance, and constant refresher. So I think having a priority on how to support these infants to access breast milk, it will give them the best chance and reduce their risk of being malnourished, and then increase their chances of surviving surgery.
I love that, Grania. Breast milk is a silver bullet.
It is.
And I just want to say one very quick thing about supporting mums to breastfeed. Mums need support to do that. But we saw yesterday a video that summarized things beautifully. Mum had a beautiful baby born with a cleft, but people said, you must have done something wrong. You're a bad person.
Yeah.
It's your fault. And what we need to do with early intervention is education, psychosocial support, community education, because can you imagine what it must be like as a mum trying to breastfeed your baby when your entire community blames you, when your family blame you? Is it any one, that is a preventable barrier to breastfeeding. And that poor mum said her milk dried up. And there is so much we can do to make breastfeeding easier, and psychosocial well-being of mum and education of communities to remove stigma around any congenital difference matters.
And just to remind ourselves that, as the UN Food System Summit is ongoing, breastfeeding is actually the first food system. And yet, I don't think we've heard enough about it in the Food System Summit. So that's something that we need to address. But Teresa, I also want to answer get to your question about funding for NGOs. So in many countries, even programs supported by the World Bank, the program may be supported by the World Bank. It is usually coordinated with the national government, but service delivery often happens through NGOs, especially in countries where national health systems may be relatively weak and are not able to deliver services. A classic example of that is Bangladesh, where most of the services are in fact delivered by NGOs. Similarly, in Senegal, almost all of the services were delivered through local NGOs. And Senegal, remember, is one of the few countries across the world, and certainly the only one in Africa, that achieved the MDG target. So I think NGOs, civil society organizations that deliver services on the ground are absolutely critical to getting these kinds of services out, especially when health services are limited. We saw that in Afghanistan as well, where it was very hard for the government to deliver services, but actually coverage of many of the essential services that Grania was referring to was relatively high, I say was, mostly because of local NGOs that were providing these services. So this partnership between governments, international organizations, and local NGOs is absolutely critical to getting to where we need to get.
Thanks so much, Mira. Grania, we've got one question dedicated to you in the chat. I don't know if you have the link handy, but someone asking for a link to your report. If you are able to put that in the chat, it looks like folks would love to have a look at that if you have it handy.
I'll do that right now.
All right, excellent. And Felicity, one last question that I think I'll direct to you before we are out of time today. What can we do to support mothers in developing countries who only have one meal a day to continue exclusive breastfeeding?
Oh, wow. I saw that question in the chat and thought what an important question it is. I think what it shows is you cannot separate baby health from maternal health. And it's again, I think, lobbying to make it clear that this is not just the right thing to do to governments, it is an investment for the future of your population. I think training, as a medic myself, we often know the right treatment, or we try to know the right treatment, but what we are not good at is lobbying for change that is impactful and meaningful. And I think that's where we need to work with people in other disciplines outside of medicine, people like Mira, looking at policy, looking at financing, it shouldn't be this difficult for a mum to get enough food to feed a baby. And, the best technical surgery in the world isn't going to make that better. So I think we in the medical world need to reach out and work with experts in other disciplines. We need to be better at lobbying. We need to work across disciplines to get the ear of decision makers, to bring in the Anganwadi workers and hear not just numbers, but patient stories, and change hearts and minds at a policy level. So here's to working together, I think.
Excellent. Thank you, Felicity. Oh, go ahead, Mira.
I'm sorry, I was just going to say, let's not forget the role of politicians and parliamentarians who can play a huge role in changing policies. We are technical nerds. We can do nice nerdy reports and push for policy changes, but ultimately change depends on what the politicians agree on. And think about the HIV/AIDS movement. What moved it was the people's movement. And so we need a people's movement around nutrition as well. Thanks.
Well said.
Thank you so much, Mira. I think that's the perfect call to action to end on, particularly today, as we're seeing the Food Systems Summit on that virtual stage. We have a host of politicians and leaders that are coming on and announcing measures that they have taken, plan to take, commitments they're making, financial decisions they're making with national budgets where they're going to allocate their spending. And that is ultimately going to dictate what happens. And, the people can push it forward if constituencies are demanding things. Governments and the private sector are going to start to listen. I think we've seen that a little bit with the climate movement, that has gained tremendous momentum in the past years. And consumers are now saying, I want sustainable, food, clothing, you name it. And I think, connecting these movements, the food systems nutrition movement with that climate movement, and, having a constituency that says, this is what we're demanding. This is how we want our food to be produced. We want to know where it comes from. We want it to be nutritious. We want everyone to have access to it. Thank you so much to all of you for joining us. This was a great conversation. As a couple of our members of the audience have noted, I always love having a panel all of women. So we had a great powerhouse today. Thank you again to our partner Smile Train for helping Devex produce this event. And I also wanted to give a little plug for Devex Dish, which is Devex's brand new food systems newsletter. I'm anchoring that. I'll be coming to you every week. We just launched it last week. And we will have editions every Wednesday in your inbox. There is a link in the chat to how you can subscribe. You can also find us on devex.com, Devex Dish. I really hope you'll join us, and I really look forward to engaging with this community on all of these issues, this conversation. Really we had an opportunity to hit a slice of this issue. There's going to be a lot more to explore in the coming months, particularly after the Food Systems Summit. Right after we hop off this, I'll be back monitoring that event, and we'll have my take on what we've seen there going forward in Devex Dish next week. So I really hope you'll join us. I really look forward to engaging with all of you and continuing this conversation. Thank you again for being with us today.